seeing the tip of the iceberg of India, and really I could come back and spend a year cycling around this country.
Don't lose the hope and don't be afraid of cancer. Cancer is curable. It's curable now.
The last 2 years have been especially trying for people living with non-communicable disease. Data shows that they are at a higher risk of severe complications from COVID-19, more likely to be hospitalized, and at a greater risk of death. People living with NCDs have been at the epicenter of COVID-19 and will continue to be during future pandemics. Thus, the road ahead for responsible healthcare lies in making patient-centric care at the heart of the treatment process and including patients the most affected in every step of the decision-making. The Global Charter on Meaningful Involvement of People Living with NCDs rallies all stakeholders such as governments, international institutions, civil society and the private sector to put patients who are people at the center of their caregiving. Be inspired. Towards patient-centric healthcare, changing treatment paradigms. Luca Grenfell-Shaw, Dev Mukherjee and Dr. Bidhu K. Mohanty in conversation with Poonam Bagai. Luke Grenfell-Shaw is the founder of the Can Live movement and the expedition leader for Bristol to Beijing, a tandem bicycle expedition across the world from the United Kingdom to China. On the 6th of December 2021, Luke and his pink and blue tandem bicycle called Chris crossed the Wagah border from Pakistan into Punjab, India. Luke was diagnosed with a rare and aggressive sarcoma in 2018 at the age of 24. His expedition invites people to participate, especially can livers, people living with cancer, and individuals from the countries through which he is riding in whatever way they can. Many participate by getting active at home. More than 200 people have participated by joining Luke on the tandem, 15 of whom are can livers. Crossing into India was no small feat, cycling 17,000 kilometers across 27 countries complicated by COVID-19. Dev Mukherjee is a 17-year-old computer programmer living in Patiala and a member of a Can Kids group of young people living with cancer in their past or present. Dev was treated for acute lymphocytic leukemia from the age of 2 to 5 at the All India Institute of Medical Sciences in New Delhi under the care of Dr. Rachna Seth. Still in school, Dev aspires to be a chef and is very excited to join Luke Grenfell-Shaw on the tandem from Chandigarh to New Delhi. Professor Bidhu K. Mohanty, MD, is the director of the KIMS Cancer Centre, Kalinga Institute of Medical Sciences in Bhubaneswar. He has been a professor at AIIMS New Delhi till February 2013 and set up cancer services at the National Oncology Centre, Royal Hospital, Muscat in Oman, Fortis Memorial Research Institute in Gurgaon and at Manipal Hospital, Delhi. He has edited the textbook of radiation oncology and cancer, larynx and hypopharynx, and has many publications to his credit, including chapters in several medical books. He was conferred a Lifetime Achievement Award by the Foundation for Head-Neck Oncology in 2016. He has served as an expert at the European Commission's research on cancer and is an external expert member for the Ethics Committee of AIIMS. Poonam Bagai is a colon cancer survivor, patient advocate and philanthropist. An economics honours graduate and a Class 1 Government of India officer, she gave up her career after she had cancer and related depression in 2000-2001 and has dedicated her life to the war against cancer. In a span of 18 years, she has founded and grown a pan-India organisation, Can Kids, Kids Can, as a national society for change for childhood cancer in India, which today partners with 121 cancer centers across 53 cities and 22 states that account for over 26,000 new cases of childhood cancer. Poonam is also the Vice Chairperson of Pallium India, a national trust committed to palliative care.
So I'd like to start by introducing you to Luke. Luke is a 28-year-old on a heroic adventure post his battle with cancer. And Luke likes to call himself a can liver, a person living with cancer, facing uncertainty and challenge on a daily basis, and yet acknowledging that they can live a rich and fulfilled life. So Luke, share with us where you are today, what you're doing in India, what brought you here, and where you're headed.
So right now I'm in Allahabad, right in the north center of India, and I'm cycling from the United Kingdom to China on a tandem bike. It's 30,000 kilometers through 30 countries. And the reason that I'm doing this is 3.5 years ago, at the age of 24, I was diagnosed with stage 4 cancer. I didn't think I would live. I didn't think I would see Christmas, but across chemotherapy, surgery, radiotherapy, I managed to live. I did everything I could to help myself. And I decided that if I could do one more thing, it's cycle across the world, show what's possible with cancer, and hopefully inspire a few people along the way.
Oh, great. And how did you get to India?
It's taken me 2 years to get to this point. A pandemic has got in the way. I've been through Western Europe, I've been through Turkey, Georgia, Azerbaijan, Central Asia, Pakistan, across the Wagah border. I've been through Amritsar, Chandigarh, Delhi, Gwalior, and now I'm here in Allahabad and very soon to be in Varanasi and then onward to Kolkata. So it's a huge adventure.
Right, it's phenomenal what you've done. As I said, you're a hero. And I think what we're talking about today is how we can look at heroes like you and others who have lived with cancer. You call yourself a can liver. I call myself a cancer survivor. But how can we take this and make it part of responsible healthcare for the future of India and, of course, of the world? So in one of your talks, I heard you say at a hospital that when you were in hospital, you said you wanted to be treated as Luke G. Shaw and not a case, not a patient. Tell me what that was about.
For me, when you're diagnosed with something like cancer, one of the first things that can go is the sense of agency and the sense of control. And when you're turned into a patient, you become passive and you are someone who is measured and prodded and poked and told what to do. And you end up forgetting that you can do things, that you do have choices and control in the situation that you're in, even if you've been diagnosed with cancer. And so for me, being Luke Grenfell-Shaw, diagnosed with stage 4 cancer, for me to be me and not a patient, it meant that I kept on doing things that I valued, that I loved. So that spending time with my family, with my friends, means being active. It means running and cycling. It means looking after my diet, putting the best things possible into my body. But in short, it means that I still know that I can do things to help myself, even when I'm diagnosed with stage 4 cancer, even when I think I'm never going to survive. You still got that option. You've still got a choice of, do you stand back and do nothing and just abandon hope? Or do you say, I'm going to do everything that I can to increase the chances of my survival and to live the best life that I can, even if I'm going through chemotherapy in hospital? And the reason that I want to do that is because it will help myself and it will mean that I get to live the best life that I can.
And
that's
so
what it is to be Luke Grenfell-Shaw.
Perfect. But switching tack completely, Luke, you also decided to raise 300,000 pounds. I know you have something to do with the figure 3 because it's 30,000 kilometers and I don't know, 30 countries. But you also decided to raise 300,000 pounds across your journey. And you were going to raise funds for charities in UK and whoever your local partner was in the journey. So what's the driver for that? What was that about?
Yeah, so we're trying to raise £10 for every kilometre cycled. So that's £300,000 in total for cancer charities. And the reason for me that this is so important is because when I was going through my treatment, this wasn't a journey that I did alone. Yes, I had my family with me, and I was very lucky to have them, and I had my friends. But then there were also so many organizations that made the journey easier and possible. And so now that I'm in a position to do other things with my life rather than just have chemo drips in my arm, I really wanted to support organizations that had helped me and also did things that I believed in. And such as helping people with cancer exercise more, because that is one of the most powerful things that we can do. But also, I am very aware that I come from the United Kingdom with an amazing health service, and this is not something that the vast majority of countries have. And so for me, it was really, really important, not just to support organizations in the United Kingdom, but in places in each country that I'm passing through that face greater challenges than I did in the UK and the doctors in the NHS face. I really wanted to support organizations like Can Kids in India to help where there's a much bigger and more acute problem and where £1 can go so much further.
Would you like to introduce this young man with you, Dave, to our audience? What's he doing with you?
So I'm doing this cycle ride on a tandem bike. It's a 2-person bike. And I've already shared this journey with 250 people across 20,000 kilometers. And actually, I'm not the exception because Dev is also a can liver. Dev has also been diagnosed with cancer. And what I think is most amazing about Dev is that when I talk to most people and I say, look, I'm cycling, would you like to join? They very quickly find an excuse. They've got some washing to hang out and they can't join. Dev comes along in his jeans, his jumper and a woolly hat on one morning in Chandigarh, probably the least prepared person I've ever seen to ride on a bike. And you know what? We've cycled over 1,000 kilometers together. And Dev shows what is possible. And he shows that there are no excuses. It's all up here. It's all your mindset. And so Dev is one of the people I have had most respect for. And to me, he is about what living with cancer is, the best example, taking opportunities and making things happen.
So Dave, coming over to you. We asked you and your mom, Manisha, who's a parent or a parent member, to go from your home in Patiala, go meet Luke, and maybe ride a little bit with him. Now, you ended up riding tandem with him, and you've ridden, as Luke just said, or you will, by the time you get to Varanasi, have ridden 1,000 kilometers. Tell us what made you do this.
So I've been also, guys, that I've been also diagnosed with cancer at that time. So one day just I met Luke and I was just really, really inspired that the person who's riding a bike from Bristol to Beijing, and it's like, he can do why I can't. So because I'm just lived that experience, so I just love to get rid of that stigma and that things. And I wanted to make people aware, what can you do with cancer and after the cancer? So that's my thing that keeps motivating me to just 1,000 kilometers. That's a thing.
Wow, awesome. And for Dave, what's important is that when you were little, your mother left home in Calcutta because the family simply said they wouldn't be treating you, right? And she moved to Delhi to look after you. And now here you are today, having become a cancer leader, growing even at the age of 17, you're able to stand up in front of people and talk about what it is to have cancer, but also that cancer is curable. Right. So did you feel that it matters that you're only 17 years old? You think people listen to you?
So it's like sometimes people listen, it's just like a percentage kind of thing. Like 60% of people are just like, don't get your weight on your talks. They doesn't take you seriously, sometimes me. But 40% of them just take me seriously. So I just that for not 40%. I need that thing to be like 100 or 90%. So that's the thing. The people sometimes doesn't take me seriously, but I want to take me seriously because I have the live example and I had live experience.
But let's move over to Dr. Mohanty. And before I ask him the question, I do want to say, and my question is centered around the pandemic, of course, and what it does to cancer at Can Kids. We have really, really fought the battle, not the battle against COVID, but the battle for childhood cancer alongside COVID. We called it a C3 initiative, right? Making sure our children are able to stay on therapy, they can get through borders, they have places to stay, they don't abandon treatment, supplying them drugs, providing diagnostics where possible. So my question to you, Doc, is how has this COVID-19 pandemic impacted healthcare delivery for cancer in India?
How do we see the pandemic from the healthcare side? Now, one example which can signify the entire picture of the pandemic to all of us, that somewhere around 60 million people die every year in the world. And in 2020, the epidemiological data of the mortality showed that beyond the COVID-19 related death, 3.6 million excess deaths took place. How do we figure it out? We have to figure it out that these deaths were largely due to the non-communicable diseases, including the cancer, because 70% of the global deaths now are taking place because of the non-communicable diseases. And this impact itself should be the big picture for the healthcare delivery systems anywhere in the world, the health policy makers and the society, to understand how do we mitigate these kind of public access needs for our sick people.
I really want to, ask you, what are the big messages you would like to share with young people in India today, right? And let's take it in turn to basically answer this. So, Luke, starting with you, responsible healthcare in a sentence.
Responsible healthcare for me is getting people moving and as active as they can be from before their treatment, during their treatment, and after their treatment. And I think that's one of the biggest things that's got to change in healthcare, no matter basically the disease in the 21st century.
So I just wanted to say that, like, I have been the live example and I've been experiencing my treatment as well. So sometimes, like, doctors should be treating us like doctors just treat the patients as a case. So I just wanted to, for them, just it's like a diseased person. So I want to like more leniency, more gentleness, like a little bit sweetness. I just wanted to like doctors and nurses and a healthcare professional more gentle towards the patients. That I want.
Okay. The next one, living life to the fullest. What do you want to share with the youth of India?
I was like being not like a really active person when I just like ride on a tandem. I just want to like people in youth, just be active as you can. Just go your life to be more active lifestyle, more about the fitness and take care about our health and live your life to the fullest.
And I think what Dev shows really well here through his own example of how he's lived his life is you don't have to be ready. In fact, you're never ready. And Dev turned up in his jeans and his jumper and cycled 1,000 kilometers. You don't need to be ready, just jump in.
All right. And as cancer survivors or advocates, do you believe you have a responsibility to advocate for patient-centered care? And would you ask any of the young people who may face healthcare issues to do the same?
I personally think it's a matter of personal choice. I think there's got to be something inside of you that you've got to share, that you want to share and just sort of release into the world. So for me, it's a matter of personal choice, but also acknowledging that when you share something that has a positive impact, that's probably the most rewarding thing that you can do in your life. So for me, it's about lifestyle and activity and looking after your body.
So I just wanted to like people let them know. So it's like talking about cancer in India. It's like they don't want to talk when we just like going through the villages, and we have seen that the people doesn't want to talk about that. So I just wanted to make them aware that it's curable. You have to just go to the hospital and just get the early diagnosis, and you can be a better person. Cancer can make you like a different person after the treatment as well. Like me and you guys, just like that. So just like I just wanted to make the people aware what you can do after cancer and what you can do with the cancer. Just wanted to let you know that.
I think what we're trying to highlight here is that patient-centered healthcare is a big piece of how healthcare will become more responsible. And a big piece of that is how young people or even anyone who's lived with cancer actually needs to contribute to make that possible. You know, the Global Charter on the Meaningful Involvement of People Living with NCDs, including cancer, says everyone everywhere has the right to health and well-being and to participate in decisions that affect them, to live their lives to their fullest potential in a healthy environment, in dignity and equality. Right? If we want healthcare in India to be patient-centric, then we'll have to place the patient at the center of it all, right? Patients, families, caregivers need to be able to participate. And we need to establish mechanisms whereby we can hear this patient voice at all levels, in hospitals, at a national, regional level. Would you agree, Dr. Mohanty? And if so, what can we do with India's health system to learn and to make it more sensitive to the needs of the patients?
One thing that we all need to acknowledge is what has happened to India's healthcare system in the last 30, 40 years. And how it is different from the NHS that Luke was talking about. In the last 30, 40 years, India's healthcare system has become very heterogeneous. We have moved from public government healthcare system to the private and more corporate healthcare systems. So what does it bring in? It brings in various challenges for our patients in the sense that how do they navigate this transition, where they should go. For example, my spouse tells me that going to the right doctor and the right hospital requires an astrological amount of work also in my country. You have to have good astrology to meet the right doctor in the hospital. But then, to tell you very frankly, it means that our patients are somewhere getting lost because of these kind of diverse healthcare delivery systems. And within that diverse healthcare delivery systems, what we need to know is that we are not dealing with what you said about the pandemic plus the non-communicable disease. We are dealing with something more than that. For the last 30 years, we started dealing with the double burden of diseases, our age-old communicable diseases with non-communicable disease. And now what India in the last 10 years is facing is what we call within the healthcare system as the triple burden of diseases. That means our age-old communicable diseases remain, non-communicable diseases are rising, and our women population's reproductive health-related issues are also becoming a challenge. Within that kind of a system, when we see someone like Dev or someone who has a diabetes or someone who has a neurological disorder, we have to realize that the healthcare system within a diverse kind of a field can only do this much. And this is where I feel that our traditional reluctance towards the CSO, towards the NGO, which is prevailing within our healthcare system across both government and private, and it remains across both government and private. It should actually go away because we can only do this much within a hospital. And unless we try to bring collaborations with the freestanding CSOs and NGOs, we cannot really achieve across the board care for all our patients because they are getting lost in the transition. What can they do?
Yeah. So you're right. I mean, one of the points that you made was that if we want to have more patient-centered care, we really have to strengthen patient navigation, right? People should know where to go. People should have access to the right kind of information. And that information needs to be readily available in a simple way that someone can understand. Which doctor to go to, where do I diagnose, how do I actually reach there? And once I reach there, who's going to hold my hand and actually take me through the journey? So having, I think, patient navigators is important. Having care coordinators is important. I see this more and more, and we are working on trying to make that happen. We are also working on the idea that we should have maybe patients like Luke, patients like Dave, who want to participate as patient navigators, parents, or people who've been through the journey, to volunteer their time and also actually engage with hospitals as well as with the system so that they can be patient navigators and care coordinators. And if they do that, if my first interaction is with someone like Dave or someone like Luke when I reach a hospital, that in itself will allow me to actually feel more towards, this is what I'm going to go through, and this is how maybe I will do better, right? So you did mention patient-centered care requires more patient engagement, right? And you did sort of touch upon the fact that civil society organizations or NGOs are a vital fourth partner, right? What are the challenges that healthcare is faced with for which actually CSOs and NGOs can be that vital pillar today and in the future?
I think this is nothing unique to India. This is global. And when we look at the civil society organizations and the non-government organizations facilitating the patients or those like Dev or Duke to engage and collaborate with the different specialities for helping out the patients, we have to say, I will say from my own example, I will say that as doctors, nurses, and healthcare workers or paramedics, we are actually functioning within a system. And you all from the public have to appreciate this thing that even though there might be challenges like what Luke or Dave say, that I don't need to be poked or they should not treat me as a case or anything. Why they experience these things is that they are functioning within certain boundaries and within certain limitations. For example, I will tell you that my entire career of working in AIIMS, unless I'm doing a particular kind of a research, how do I reach out to the patients? That research only ethically allows me to reach out to the patients. Otherwise, on my own, if I will try to reach out to the patients, it might be construed wrongly. That's the average thing anywhere in the world. Then what happens is that I will give you my own example. We did a clinical audit, and surprisingly, we found that after all diagnostic tests, after the diagnosis of the cancer, 56% of the patients in AIMS were not getting the complete treatment or were becoming non-compliant. So we don't know their socioeconomic reasons, their hurdles that they face. Why, having come to that place where they felt that they will get the right treatment, they have fallen off. So this is where I will request that I have learned over the years how much the volunteers and people like you have really helped me in my work. But maybe that kind of a thing which should be all embracing, where the entire department or an institution partners with a particular kind of a facility like a CSO or NGO. I would say that although I have learned individually, but it has to come within a system. And that kind of volunteerism is still far from what should be ideal, I would say.
I think what's important, I think the big takeaway is that if you have a civil society organization or an NGO that works alongside, let us say, a hospital institution or partners with the government, then the NGO or the civil society organization works to build up the patient navigators and the advocates, takes Dave's story and helps to build up Dave, as we are doing, to be a patient leader, to be a patient navigator, to be a patient ambassador, to understand all the multifarious needs and to work equally as a partner, as a vital fourth partner, be it to a local hospital or a local government or even the central government. And I think when we do that and we engage our patient or our beneficiary into healthcare, we will have a much stronger, more responsible, patient-centered healthcare. What does right to health mean to you for the future of other people who will go through the experience that you have been through?
I think for me, the right to health is the opportunity to be treated as a human being, as a person, ideally with the best drugs and facilities that can be provided. And I think it's a two-way bargain that the healthcare authorities need to do everything that they can to ensure the health of the person, and the person's got to do everything that they can to ensure their own health. So I think it's a two-way thing.
So right to health too for me is just like people who just like get diagnosis, and I just like early diagnosis, and the treatment should start at early stage. So we can just at the initial stage, if the treatment starts, that there will be no sign of thing. So that for the early, like it should be a compulsion for the early to diagnose and early treatment starts. That will be a thing for me. I just agree with Luke that the patient should be treated as not as a case, just like a person, just like a human being, or just by the name. Patient should be treated like that.
For me, I think the right to health is from birth till the death, there should be the provision for sickness and the access for any kind of sickness, irrespective of the person's economic or social strength. And that kind of a situation should come only from the society. As society has demanded for right to education, or as society has asked for franchise kind of a thing, similar kind of thing has come. And that kind of a thing is coming. For example, I spend more time with the patients than probably what my seniors were spending. And the younger generation is becoming much, much more aware, like what Dave is telling, that to love a person like Dave on the corridor and ask, have you eaten your meal or not? That is right to health.
We always think that there's time in the future.
But what if someone tells you there is no later?
We must live 100%. And who knows?
Be inspired. An innovation can change the world. All we need is passion, focus, and a desire to help. If you have an innovation, please send it to us at whatever stage it is in. Our panel of experts will assess it and help propel it towards reality. The sky is your limit. Don't wait. Mail us your idea or innovative thought at beinspired@teamworkarts.com.